Macular degeneration comes in two different forms, and I like to illustrate this with an analogy that goes like this. Your retina, the back of your eye that's involved in macular degeneration, think of it like a sidewalk. If you had a sidewalk that was very old, let's call it 70 years old, because most patients who have macular degeneration are older, what happens to the sidewalk? Well, the sidewalk gets cracked. We call those cracks dry macular degeneration changes, okay? And at the moment, we don't have medication that acts like pavement that could pave over those cracks. So we just let them be. We don't mind dry macular degeneration changes at the moment. What we care about is this scenario. Think of a sidewalk now with cracks in it, and think of grass growing through those cracks. That scenario happens in your eye, except it's not grass, it's blood vessels. Microscopic blood vessels can sneak up through those cracks, and what do blood vessels do? Blood vessels leak and they bleed. And when that happens in the eye, we don't call it dry macular degeneration, we call it wet macular degeneration. Now in this analogy, we have medication that I deliver in my office into the eyeball directly that acts like weed killer. It makes those grass or weeds regress. And when the grass regresses, the leakage associated with them also regresses and vision gets better. So in summary, there are two forms of macular degeneration, the dry and the wet. And I hope you found this analogy of the two very helpful. Thank you so much.